Hey guys, my name is Sarah, and I'm going to be helping you with something called benign paroxysmal positional vertigo. It's also known as Bppv. Today I'm going to walk you through doing what is called an Bppv maneuver, which is an exercise that can be done at home and in an office setting with a healthcare provider. I'm going to safely teach you how to do it at home, and this should help relieve some of the symptoms you may be experiencing with Bppv. Bppv is a problem that starts in your inner ear. It's an exercise. This exercise that we're going to do helps the inner ear problem and helps reduce the symptoms you may be experiencing. A lot of people experience dizziness, a sense of spinning, loss of balance, unsteadiness, nausea, and sometimes even vomiting. Symptoms vary from person to person. Before even starting an Bppv maneuver, it's important that you have an actual diagnosis of Bppv. This is typically something that's done by a healthcare professional. However, I'm going to show you how you can do it safely at home. The first step is you want to find a flat surface, somewhere where you can lay down comfortably, usually a bed or a couch. You want to make sure you have enough room to move your head freely without anything getting in your way. You can also keep a pillow handy in case you may need a little bit more support for your head. The second step is you're going to sit on this flat surface, either your couch or your bed, with your legs extended in front of you. I'm going to have you turn your head to the side that brings your vertigo on, meaning when you turn your head to the right, does that make your vertigo come on? Or if you turn your head to the left, does that make your vertigo come on? Whichever side it is, I want you to turn your head slightly, about a 45-degree angle. So not quite a full turn, but a slight turn, if that makes sense. Step 3 is where I'm going to have you lay back quickly. This is where your pillow may come in handy to soften that lay. When you're laying back quickly, it's important that you keep your head slightly turned, like we talked about in step 2. So keep it at that 45-degree angle. When you bring your head down, you should have your shoulders on the bed, or the couch, but you want your head slightly hanging off of the edge. You need to stay in this position for about 30 seconds, up to a minute, and it is important to know that you may feel vertigo during this time. Just try to maintain that same position. Keeping your head in the same position, hanging over the edge, rotate it to the opposite side. So if you're on the right side, you're going to rotate it to the left. If you're on the left side, you're going to rotate it to the right. You're going to hold this position for 30 seconds to a minute, and you want your head to be at that slight turn on the opposite side, so 45 degrees on the opposite side of what you started. So while you're keeping your head turned, you want to slowly roll onto your side. This may seem a little awkward, but know that this is how you do it. You should now have your head facing downward, but it should still be at that slight turn. You're going to hold this position for at least 30 seconds up to a minute. The final step is step 6. You want to be extra careful, and this is going to feel awkward, but I'm going to have you slowly sit up while keeping your head at that slight turn. If after finishing performing this Bppv maneuver and you're still experiencing the Bppv symptoms, you can repeat it following the same steps. It's really important to try and avoid laying flat for at least 24 hours after doing an Bppv maneuver. And try to reduce the sudden movements that may trigger your vertigo, because you don't want to go through this Bppv maneuver and then make a sudden movement and then all of a sudden you're right back to where you started. And the most important thing to remember is if you don't have any relief with this maneuver, it's important to reach out to your healthcare provider.